Have you recently been discharged from physical therapy and now you're wondering what exercises and what stretches you are supposed to do now? Well, my name's Dr. Samantha Smith. I am a knee replacement physical therapist, and I'm going to tell you what your next phase of recovery should look like. Most people get discharged from physical therapy between 6 and 12 weeks post-surgery. So you are still in the beginning phases of your recovery at 6 to 12 weeks. You still need to exercise, you still need to stretch to increase your strength, to increase your flexibility, and to return to those activities that you would like to do, whether that's returning to pickleball or walking your dog or just being able to stand at the kitchen sink with less stiffness and pain. Your physical therapist should have discharged you with a sheet of exercises called your home exercise program, with some exercises that you can focus on in your later phases of recovery. But progressing those exercises is extremely important. You can't do those same exercises over and over and expect to increase your strength, decrease your pain and stiffness. You have to work in different exercises. I'm going to show you my top 3 favorite stretches today and my top 3 favorite exercises that you can work on after you're discharged from physical therapy. My favorite exercise for knee bending is just a simple seated knee bending stretch. You're just going to sit in your chair with your surgical leg. All you're going to do is just bend it back. Hold this stretch here for about 30 to 60 seconds, then relax that leg out in front of you, and you're going to repeat that 3 times. This is one of my favorite stretches, one, because it's really convenient. You're sitting in a chair. It's easy to remember while you're watching TV, reading a book, just to bend that knee back, stretch it, and for 30 to 60 seconds. Really easy to do. You can also do it in the car as well. And then right after you're done doing your 3 reps of knee bending, you can move into your knee straightening exercise if you're working on knee straightening as well. I recommend stretching, knee bending, and knee straightening at least once a day for a full year post-surgery. So you are going to have stiffness and tightness of those muscles of the knee joint for about a year. So it's good to stretch just once a day for about a full year. If you're still working on improving your range of motion, you're still not there with your goals quite yet with your bending and straightening, you need to stretch more than just once a day. Usually maybe 3 to 5 times a day you'll need to be stretching. If you need a full program for bending and straightening, I have knee bending and knee straightening courses now on my website, succeedcourses.com. But this is one of my favorite straightening exercises. You just prop your leg right out in front of you. The heel is down on the floor. You're sitting at the edge of your chair. Sit up nice and tall and then lean forward at the chest. You'll feel a pull in the back of the knee. This is one we do in the knee straightening course quite often. We're working those hamstrings in the back of the knee to get them to stretch. Again, hold for about 30 to 60 seconds. Then you'll want to take a break and you kind of need to lift that leg up to give yourself a little assistance, because after a long stretch for 60 seconds, it's going to feel tight. And then place that leg right back out in front of you. Same thing, lean forward. The leg over here is just here for balance support. So you can bend it, you can put it over here. It's just a stabilizer, so you don't have to do anything super special with the leg over here. This is the leg we're working on as we stretch that hamstring. Again, use your hands to assist you to bring it right back up. Then my next favorite stretch is going to be a hip stretch. So if we are working on bending and straightening of the knee, you also need to be working on hip mobility. So when we bend and straighten the knee, it's just not working the actual knee joint. There's other joints attached to the knee itself. We have to work those muscles and stretch them as well. The ankle, the foot, and the hip. We're going to work on a hip stretch here. This one is called the figure 4 stretch. With your knee replacement knee, you're going to try to place the ankle on the opposite shin and just let that leg drape out to the side. If this is fairly easy, next you're going to place that ankle on the opposite knee, bend that knee, and you're going to get into this figure 4 position here. You're going to feel some tightness in the back of the hip area. If you're really flexible, push that knee down towards the floor. This is a tough one. This is great for getting the shoes on and off, socks on and off as well. A lot of times the knee will be all the way up here as you start the stretch, and then eventually we want to work it so your knee is actually parallel with the floor. That would be full mobility. As we age, our hips do get tighter, so you might not get that full mobility, and that's okay, but it's a great stretch to work on if you're working on knee bending and straightening. The more advanced way to do the stretch, the more beginner way to do the stretch is with that other leg fully extended and that ankle is on the shin, kind of draping the leg out to the side. So I'll give you another viewpoint here. Looks just like this. The leg is draped out to the side. You should feel a little bit of stretching in the hip. So very important to work the hip joint if you want to improve bending and straightening. So these are principles that we go over in the knee bending and straightening courses. If you're interested, you're working on that mobility still of your knee, please go to succeedcourses.com. You'll get my full 3-week program, lifetime access, great program to join if you're still working on your bending and straightening. Now let's go over some strengthening exercises that you can do after your discharge from physical therapy. My favorite exercise is stand up, sit down. So exactly what it sounds like. You're gonna stand up and you're gonna fully sit down. So this would be a leg strengthening exercise. Really great for the quads, really great for the hamstrings and your glute muscles as well. So if this causes some knee pain for you, what you can do is either get a chair with some arms and push up and down with your arms just a little bit, or you can place a pillow under your bottom. Lift yourself up just a little bit and then complete the exercise. Be sure to choose a fairly thick pillow that will lift you up just a couple inches. That way the exercise is a little bit easier on the knee. Once you master stand up, sit down with a pillow, then you can remove the pillow and continue the exercise, building up from there. My next favorite exercise is going to be a heel raise and a toe raise. So up on your tippy toes and up on the heels. So this is working ankle mobility and ankle strength. All of those muscles are connected to the knee. These muscles help you with balance. So after a knee replacement, you're going to need to work on your balance. It is normal to feel wobbly after your knee replacement. They did just replace a full joint, which communicates with your brain. You're going to need to work on exercises that support your balance. So heel raises and toe raises are a great exercise for that. When you do a heel raise, make sure your full body goes up towards the ceiling and you're not leaning forward. That's a common mistake that people do with heel raises. And with the toe raises, what you can do is lean back just a little bit, lift up those toes, really contract those shin muscles, and then come back to standing. So up on the tippy toes, straight up towards the ceiling, lean back a little bit and lift up those toes. Another exercise I really like, this is a more advanced exercise, is a lunge. You can start out with doing just a mini lunge, a small step out in front of you, bend that knee, and then what we're really working on is that push back. So you can do both legs with this one, really work on that push back. So when you're in this position here, try to push back to the standing leg. If you're pushing back and you're going like this, you may need to take a smaller step out in front of you and push back to standing. Be careful with the kneecap in this position. We don't want that kneecap going too far forward over the toes. That can put too much pressure on the knee joint. We want to have that knee lined up with the ankle, then push back to standing. So work both legs with this one. It's good to practice those steps going forward and that push back. Again, as we age, we lose some of those reactions with pushing or with stepping forward, and we lose that power with pushing backwards. So this is a really great exercise to do. As we age, it hits a lot of different things, like we said, power and balance reactions. If you'd like to work with me in an online exercise class, I go over all these types of exercises in my online exercise classes at succeedcourses.com. You can join me, work with me. It's a 4-week program. We go through all these different types of exercises. I help you progress with the exercises, so each week gets a little bit harder. So I tell you exactly what to do. You don't have to think about it. You let the expert do that for you. You will get stronger. You will have less stiffness and pain. Please join me at succeedcourses.com. Would love to have you in my exercise classes or my range of motion courses as well if you're working on your knee mobility still. Thank you so much for watching, and I'll see you again next time.